Dr. VanDyke here, board certified endocrinology, talking one more time about when to intervene with a thyroid. So the question of, who with a thyroid problem can be managed by, say, the primary doctor, or who with a thyroid problem needs to see a specialist. Generally speaking, most garden variety kind of hypothyroidism can be managed by primary care without any problem. Some cases of hyperthyroidism also can be managed by primary care, but in my experience, at least where we are in Texas, most hyperthyroidism comes to the specialist. Now, thyroid nodules, if you just have a little one or a couple or maybe a cyst that's not that important, that might be managed by the primary doctor. For goiters that are very large, or someone who's having severe hyperthyroidism from a nodule that's making extra thyroid hormone, this is time for a specialist, because we may need to do surgery to remove what's causing the problem, or we may need to do an ablation. There's a couple of different ablations we can offer. For jumbo thyroid cysts, there's ethanol ablation, which is like a chemical scarring of the inside of the cyst that prevents fluid from forming again. There's radiofrequency ablation, usually for benign nodules, sometimes for recurrent cysts, and occasionally for very tiny, simple thyroid cancers. And it's like a biopsy that kind of ends up cooking the inside of that thyroid nodule, and then it just kind of goes over time. But sometimes we need help from our friends, the ear, nose, throat surgeons, because somebody has a truly large goiter, or they're having a thyroid crisis, a very severe hyperthyroidism, and that thing has to come out. And I do prefer to use ear, nose, throat specialists so that the incision is as small as possible. It's the parathyroids are identified and protected, and that the recurrent laryngeal nerve is monitored throughout the surgery. And it's just my preference to use the specialty surgical team for that. And then after that happens, then you come on back down to the endocrinologist, and we make sure thyroid function and calcium balance is doing what it should.